So
Likewise.
how important is it that people get this shot as we are seeing cases of COVID-19 go up this fall?
I think it's quite important for people to get a bivalent booster when they are eligible to do so for a few reasons. I think the Omicron component of the bivalent vaccine has been shown to provide better antibody titers, and I think we're accumulating more and more evidence that where you get the biggest protection is relative to how long it's been since your last dose. So certainly for people who are definitely at 6 months or beyond since their last dose, assuming they didn't get infected in the interim, those are the people who really should go and get one of these boosters as soon as it's available.
So just to be clear, are we then talking for some folks about a fifth COVID shot?
That's correct. I think there's been some talk throughout the course of the pandemic as to whether we will wind up with regular recurring boosters in the same way that we have seasonal influenza vaccine. And it's certainly a real possibility, I think, given the way that this pandemic has evolved.
Okay. If you've had Moderna shots so far and you're thinking about getting your next shot, can you take this Pfizer approved shot?
Absolutely. You don't get a special set of giftware for staying only with one product or the other. I would say whatever the most easily available bivalent booster is, that's the one to get. Of course, Moderna has been approved a little bit before, and it's now distributed across most parts of the country. Pfizer approved more recently and is just coming online in Ontario as of today.
Let's talk about long COVID. Vaccines protect people from serious infection, but what about that? We're hearing more and more people talk about long COVID. They feel they have it.
So that's, I think, something that we are still coming to terms with in terms of having good definitions for what constitutes long COVID, which is quite critical when you're talking about a disease that can have so many different manifestations. There certainly has been some continued suggestion in the literature that vaccination can help both reduce the risk of ever going on to have long COVID, and in certain situations may even be a part of the treatment of it, although that's an area that is still under a lot of active investigation.
Yeah, and what about the stress that long care COVID cases are putting on the healthcare system? Do you think hospitals are prepared to deal with these people?
I think when you look at some of the numbers across the country in terms of numbers of beds that are occupied right now, the ongoing difficulties we're having with staffing, I think you make a good argument that we're on the edge of being prepared for the regular things that hospitals should be dealing with even before anything to do with the pandemic. So I think any additional stress to the healthcare system is something that we need to take a very active role in trying to reduce as much as possible, because I really don't want to see our healthcare system, if we have, for example, over the course of this winter, surges of COVID-19 cases as well as influenza and other respiratory viruses on top of where we currently are.
Dr. Oughton, great to see you this morning. Thanks so much for all that. Really appreciate it.